Welcome back. This is Module 2, where we will discuss levels of ability and wellness in MS and the various levels or spectrum of disability that you may see in your MS client.
We believe that people living with MS can be healthy and well, but wellness, exercise, and lifestyle physical activity may look different depending on where your client is in their MS journey.
Let's first review our objectives for this module. This module is intended to describe optimal wellness in MS and help you better understand your place as a fitness and wellness professional in comprehensive MS care. By the end of this module, you will also be able to define the Expanded Disability Status Scale, or EDSS, and recognize how functional limitations and disability in MS impact exercise and lifestyle physical activity. A greater body of research in wellness in MS has led to a better understanding of what optimal wellness in MS means. Optimal management of MS involves disease modification and symptom management, as well as lifestyle interventions with the goal of protecting and enhancing quality of life. First, let's talk about disease modification. There are over a dozen disease-modifying therapies, which are medications approved by the FDA to treat MS. These medications have been found through clinical trials to reduce the number of relapses, delay disability progression, and limit new disease activity as seen on MRI. A wide variety of medications are used to help manage MS symptoms, as well as non-medication interventions. Non-medication interventions for symptom management can include physical therapy and exercise, as well as occupational therapy to help with adapting activities of daily living, and mental health to address psychosocial aspects, including depression and anxiety, two very common symptoms in MS. Overall wellness is important in MS. This includes preventive care to manage comorbid conditions like high blood pressure and high cholesterol, since when not managed properly can worsen MS. Addressing modifiable risk factors that can impact MS, like smoking, alcohol consumption, and low vitamin D. Eating a healthy diet, adequate fluid and fiber intake, and maintaining a healthy body weight may be beneficial in MS. Tending to emotional well-being, including mood and stress management, developing good sleep habits, and doing things that bring joy. We will touch more on exercise in MS in a later module, but I'm sure it's of no surprise that exercise and lifestyle physical activity is highly recommended for everyone living with MS as part of overall wellness, no matter the person's level of disability. Lifestyle and wellness approaches are part of the comprehensive management of MS. The dimension of wellness seen here act and interact in ways that contribute to overall well-being in people living with MS. Physical wellness, including exercise and physical fitness, are important for everyone living with MS, regardless of their physical status and abilities, because of its influence on the other wellness dimensions. For this particular training, we will focus on physical wellness. Physical wellness involves making positive lifestyle choices about regular physical activity geared to abilities, healthy eating, weight control, MS care and primary care, and preventive health behaviors, including smoking cessation, limited alcohol use, and attention to personal safety. Now that you have a better understanding of wellness in MS, let's talk about who is involved in managing wellness and other healthcare-related needs for people living with MS. Optimal management of MS is best achieved by the person with MS, working with a comprehensive team of professionals. Someone living with MS may never need all of these members on their care team, but it's good to know who they are. It's also possible that there is a professional involved in MS care that is not listed here. People living with MS will likely work with one or a combination of the following specialists to manage their MS care: a neurologist who is a doctor trained in treating diseases of the nervous system, or an advanced practice professional, which is a nurse practitioner or physician assistant. In addition to the MS care provider, a comprehensive MS care team may also include rehabilitation specialists who provide interventions to restore or maintain function and independence. This includes a physiatrist, which is a doctor trained in physical medicine and rehabilitation, or a physical therapist who is a movement clinician who addresses problems with gait, balance, strength, flexibility, and coordination. It may also be involved in working with people living with MS on optimal exercises for their ability levels. So it can be important for fitness professionals and physical therapists to communicate if both are providing support in this area. An occupational therapist is a clinician who provides strategies to perform activities of daily living independently, conserve energy, and improve cognitive function. These professionals focus on how to adapt activities that are important to people living with MS. Communicating with them could offer trainers and coaches insight into appropriate functional goals that may be motivating to the person living with MS. A comprehensive care team also includes mental health and other providers who specialize in areas other than neurology and who can be helpful in managing symptoms or health conditions that affect or are affected by MS, such as a urologist who specializes in the treatment of urinary symptom conditions. Primary care providers are clinicians who focus on overall health and wellness and treat common illnesses. Wellness professionals include nutritionists, wellness coaches, and personal trainers. You can see this is where you fit into the MS care team. You may also receive prescriptions or referrals for exercise from other members of the MS Comprehensive Care Team. It is important for the fitness and wellness professional to not only understand MS symptoms and who helps manage those symptoms on the comprehensive care team, but also to understand MS disease progression and the impact on physical wellness. As we've mentioned previously, MS can look different for different people. Some individuals may have very few or no symptoms, while others may have symptoms that impact their ability to participate in some types of exercise and physical activity. It is important for the fitness and wellness professional to not only understand MS symptoms and who helps manage those symptoms on the MS Comprehensive Care team, but also understand MS disease progression and the impact on physical wellness. As we've mentioned previously, MS can look different for different people. Some individuals may have very few or no symptoms, while others may have many symptoms that impact their ability to participate in some types of exercise and physical activity. To help you better understand some of the symptoms, impairments, and abilities associated with MS, over the next 4 slides, we will review the information outlined in Table 1 of the paper, exercise and lifestyle physical activity recommendations for people with multiple sclerosis throughout the disease course. You may also want to reference that table for additional details. The Expanded Disability Status Scale, or EDSS, is a tool used by healthcare providers to quantify disability in people living with MS. It is the gold standard in clinical studies and often used clinically. The 3 EDSS ranges or levels outlined here are 0 to 4.5, mild impairments, 5.0 to 6.5, which is MS characterized by greater mobility impairment, and 7.0 to 9.0, which is MS characterized by diminished ability to carry out activities of daily living. It may help to consider these impairments as you create adaptive classes and exercise routines for your clients. In a later module, we will further outline how you might notice symptoms and limitations in your clients and provide examples of exercise routines, demonstration videos, and other considerations based on disability level. Assistance from a trained exercise or rehabilitation professional becomes increasingly important as disability increases and overall safety becomes an issue. So Emily will provide more specific recommendations for people in the 7.0 to 9.0 range later in this training. Before we go any further, we would like to take a step back to recognize the abilities of people living with MS at each EDSS level. Though we are using some very technical descriptors today around limitations and impairments, we should highlight again that anyone living with MS still has abilities, though that may look different for each person. While it is important for professionals working with people living with MS to understand the limitations that may be involved, it is equally important for the exercise professional to use positive language and interactions to also highlight any capabilities that the client has retained. Something to keep in mind is that your clients may not know their EDSS. They may have never been told that number. You can request that they get that number from their neurologist, or you may also be able to deduce approximately where on the scale your client falls by a number of indicators, which we'll review next. To help you better understand the functional limitations and abilities of people at each level, we'll dive a little further into each EDSS level and what that might look like in your clients. First, we will talk about the group of clients with MS who have mild impairments and what symptoms you might notice. For participants who are at the 0 to 4.5 level, they may have normal or near normal physical capabilities. This group may have no MS symptoms or may have mild to moderate fatigue, unsteadiness or imbalance, sensory changes, walking impairment, and vision problems. Some may have bowel or bladder problems or may struggle with some mood or cognitive limitations involving information processing and memory. There is potential for mild to moderate muscle strength, tone, and endurance limitations, or the person may not always have complete awareness of the position and movement of their body. People at the higher end of this range, at an EDSS of 4.5, will be ambulatory, able to walk without aid for 30 meters, require some assistance with activities, and have at least one area that would be considered relatively severely impaired. This may help you better understand where this level of ability ends and the next begins. For your clients who have moderate symptoms and limitations, exercise may need to be modified due to progression of any of the symptoms and impairments mentioned for the first level. You may also notice increased difficulty in moving the upper extremities or walking due to spasticity and increased muscle tone. You may also notice foot drop, and your clients at this level may start to rely on a mobility device, such as a cane or a walker, some or most of the time. Some people in this group may rely on a wheelchair to cover long distances. With this group, the risk of falling is increased, and the client may require some help or adaptation with activities at work or at home. A support partner may need to assist the person with transferring on and off the floor or to a chair. Please keep in mind that safety is a concern, and discussing this with your clients is very important at this stage. Someone with an EDSS definition of 6.5 requires constant bilateral assistance, using canes, crutches, or braces, required to walk about 20 meters without resting. This definition may help you better understand if your client is moderately or severely impaired. At the higher EDSS levels of 7 to 9, the individual will have continued worsening of all of the symptoms and impairments mentioned for the first two levels. Walking may be limited to 10 feet with a walker, or the person might use a powered wheelchair all of the time or spend most of the day in bed. The person will require either full or total assist in transferring or moving around in the bed. If your participant has significant limitations, they may or not be able to sit upright and hold seated balance unassisted. The person may be able to stand with bilateral support, so support on both sides of their body, like in a standing frame, or they may not be able to stand at all. At this point, I bet you are asking yourself, so what does this mean for the fitness and wellness professional? Or how do I translate this into a class with individuals who may be at different EDSS levels? Now I'm going to hand the conversation to Emily, who will dig further into how this information about EDSS can translate into exercise and lifestyle physical activity for people living with MS, no matter their ability status, and important things to consider as you develop a program or class.
As we've learned, MS impacts individuals in a variety of ways, and often these symptoms can vary. It may be helpful to think of MS as an iceberg. There are symptoms that we can identify and see. However, many of the symptoms are invisible or underwater. Symptoms from MS can come and go. They may be apparent one day, but sink below the surface the next. Exercise can also make some symptoms like heat sensitivity or fatigue more apparent, or other symptoms like balance and dizziness may be more of a concern while someone is exercising as compared to the rest of the day. Unless your client tells you how they're feeling, you may be unaware of some of the symptoms they're experiencing, which can impact what they are able to do that day. This highlights the importance of checking in with your client each time you meet. In the next few slides, we will discuss considerations when modifying for symptoms and some other tips and tricks to make sure you set your client up for successful workouts. As we take a deeper dive in the impacts of the most common symptoms someone may experience, I encourage you to print off the PDF below or have it open to follow along as we go through this section. Heat sensitivity. This is one of the most important things to be aware of. Heat sensitivity can quickly create a domino effect on an individual. Becoming overheated or exposed to warm temperatures over an extended period of time can exacerbate underlying symptoms. The way to combat heat sensitivity includes a few key aspects. Allow for rest to reduce core temperature. Make sure you have a fan available, cool towels, cooling garments like a vest, and if possible, cooler room temperatures. Working out outside is not ideal, but having shade, a fan, and cool towels available is critical. Also, make sure clients are staying hydrated as well. If left unattended, heat can have a negative implication on clients. So make sure to communicate throughout the entire workout session and encourage to take breaks. There is no shame in that. Some exercises to consider: utilizing indoor activities in a cool environment. Consider aquatics, as long as the water temperature is under 85 degrees. Fatigue. As previously mentioned, fatigue is one of the most common symptoms, yet it is also an invisible one that can negatively impact the success of a workout. Fatigue can impact participants in a myriad of ways. MS fatigue can be described as overwhelming exhaustion with no apparent cause, which decreases energy levels and often is not improved with a nap. MS fatigue can lead to cognitive fatigue or mental exhaustion. Muscular fatigue can also be a factor in MS fatigue, which can affect balance and coordination. So how do you combat these during a workout session? Well, allow for extra rest periods to give individuals an opportunity to recover. Frequently check in to see how individuals are feeling by using the rate of perceived exertion. Fatigue can also be a result of improper nutrition prior to working out, so make sure to encourage participants to eat something before coming to give their body energy. Review the symptom impact chart for more details and description. One interesting fact about fatigue is that exercise can actually help improve fatigue. It may seem counterproductive, but when used appropriately, exercise can be a great way to combat fatigue. Now, one thing to notice: if fatigue from the workout exceeds 2 hours, then it is recommended that intensity, frequency, and/or duration of the workout needs to be reduced. Some exercises to consider when dealing with fatigue: use stationary equipment or mild interval training or cardio. Cognition. 34 to 65% of people living with MS experience some kind of cognitive deficit. Information processing and memory are the most commonly affected cognitive domains in MS. What this means is your client may find understanding and following directions difficult or challenging. To mitigate these frustrations, you may want to consider simplifying directions, repeating often, and/or writing down the plan for them to reference. We always want to set our participants up for success. Cognitive fatigue is also something to be aware of. This often occurs if it's been a long or stressful day, higher temperatures outside, or an individual is already fatigued. If this occurs, focus on taking a break. Focus on breathing and quiet the mind. Some exercises to consider: avoid fast, dynamic group exercise classes. Sometimes people might seem irritable or frustrated due to the misunderstanding. Other times, this can be an indication that their mood may be affected due to MS, which brings us to the next symptom: mood. Mood can be tricky to pinpoint, but if there is a sudden shift in mood swing or irritability, this might be an indicator that it is time to check in with your client and ask, how are you doing right now? Some considerations if this occurs: take a break from what you're doing. Have them practice some deep breathing or relaxation breathing and slow things down. Lastly, be positive and uplifting. Some exercises to consider: maybe try yoga or stretching or deep breathing, or find something that is enjoyable for them. Giving clients permission to listen to their bodies, check in, and slow down and rest is key. We want them to have a positive experience when incorporating exercise in their lives. Vision. If individuals are experiencing visual impairments such as optic neuritis or have permanent visual impairment, safety here is key. Visual deficits can increase risk of falls, and it affects balance and coordination. To ensure safety, make sure workout area is cleared of all tripping hazards, the area is well lit, and even consider using stationary equipment. You may want to consider speaking with healthcare professionals for more direction. Some exercises to consider: like I said, using stationary equipment, maybe use a balance bar or a parallel bar, also using adaptive walking devices. Spasticity. Spasticity can look different for each individual, whether that's tightness or pain in the muscles. The key with working with patients with spasticity is to communicate and focus on gentle, slow movements and working available range of motion. Devote more time to warming up muscles. Medications for spasticity can overly relax the whole body. If medications are impacting exercise, refer back to physician for guidance. Some exercises to consider: perform strengthening exercise for opposing muscle groups. Use slow rotational stretching or aquatic exercises. Bowel and bladder symptoms. Though these symptoms can be a sensitive subject to discuss, over 80% of people living with MS experience some kind of bladder symptoms, and approximately 60% experience bowel symptoms. Encouraging participants to empty bladder before working out may help. Also encourage frequent hydration to avoid dehydration, as well as encourage frequent bathroom breaks. Some exercises to consider: work the lower abs or core strengthening, gluteal or adductor muscles, consistent breathing exertion, and emphasizing when to exhale when doing postural exercises. This body check-in may only be necessary for the first few sessions, but it's a great tool to use throughout the workout session to check in with your client at the beginning, middle, and end of the workout. Eventually, this will empower participants to become more self-aware and learn how to listen to their bodies. This may help them anticipate when they should use adaptive equipment for safety. This can also be a great tool to use as a part of their journaling or recording of exercises and how they're feeling so that they can share it with their healthcare provider too. You can find the PDF of this chart down below in the additional resources section. Let's review some general guidelines. Prioritize safety for every participant to avoid falls or injury. Avoid pushing participants beyond their abilities and understand when modifications are needed to optimize the exercise experience. Consider that stress or time of day, lack of sleep, or poor nutrition may exacerbate various symptoms. Allow for frequent breaks and checking in with clients about their symptoms before, during, and after workouts. Change the intensity, frequency, and/or duration of the workout if fatigue post-workout exceeds 2 hours and symptoms do not return to baseline. Utilizing a mobility aid at the beginning of the workout may not be necessary, but the client may need one at the end. Here's a rule of thumb. Refer to a healthcare provider if walking challenges, muscle tightness, spasms, spasticity, or pain are interfering with safe exercise participation, or if a client is experiencing new symptoms or worsening of existing symptoms for more than 24 hours. As trainers, we often spend a lot of time with clients, so if you begin to notice changes, complaints during increased difficulty with weakness or walking or other new symptoms, we want to encourage them to communicate with their healthcare providers. If you're comfortable with having conversations with healthcare providers, it's important for you to be in an open communication with other members of the comprehensive care team to ensure fitness program is complementary and not conflicting with other care plans, particularly physical therapy. This is where the body check-in chart will be helpful. If you do not feel comfortable having these conversations directly with the members of the care team, encourage the participant to communicate their workout routine with their care team. Up next is Module 3, Exercise and Lifestyle Physical Activity in MS.